Okay, I'm assuming you guys have been taught about meningitis. There's two types. There's bacterial and viral, which is otherwise known as aseptic meningitis. So bacterial meningitis is an infection of the meninges. And we're going to see cues such as level of consciousness changes, irritability, lethargy, headache, nausea and vomiting, photophobia, potentially increased headache with sound or movement, and nuchal rigidity. Some of the things we're going to do to manage patients with bacterial meningitis. First of all, if we suspect it, we need to do a lumbar puncture as soon as possible, as well as blood cultures and urine cultures. And as soon as we've gotten the LP and blood and urine cultures, then we immediately start antibiotics and place the patient in isolation. We do strict I's and O's, and as nurses, we should decrease the stimuli to the patient. Family members should not, there shouldn't be 20 family members in the room talking, laughing, bothering the patient. There shouldn't be TVs and computer screens. They should be allowed to rest and be in a calm, dark environment. And then we're going to monitor them for worsening cues of increased intracranial pressure. So the viral or aseptic type of meningitis is the most common in infants. So under 1 year of age, bacterial meningitis is super unlikely. It's most often viral in nature. With these kids, same thing. If we suspect it and we see all of the cues that you would normally see with bacterial meningitis, we're going to, regardless, set them up for a lumbar puncture, do blood culture, do urine culture, and then treat them aggressively with antibiotics like they are a bacterial meningitis patient. Once we receive negative cultures for bacteria, then we can start antivirals, or we can just provide supportive management to help them through it. And the duration of symptoms is usually 3 to 10 days. And we are going to, control their headaches with and fevers with antipyretics and analgesics. We're going to try to give them good nutrition and monitor any increased intracranial pressure just like we would do with bacterial meningitis. I do want you guys to think about what you would expect to see in the lumbar punctures for either of these types. So we do look at the protein and glucose as well as the fever spikes to be able to point us towards whether or not we think it's bacterial versus viral. So I always think in bacterial, you're going to have really high fever spikes, all the way up to like 102, 103, potentially 104. They're going to be very shocky looking kids and really irritable and highly stressed. Almost like they jump when you touch them. And their LPs are going to show almost low levels of glucose and super high levels of protein. And I like to think of it as like the Pac-Man is the bacteria. And the little Pac-Man's going around and eating up all the sugar and then crapping out all of the protein. So you have no glucose because the bacteria is eating it up and then pooping out proteins. And we don't really see that in viral types. Also in viral or aseptic types of meningitis, we don't see as high of fever spikes. They might only be 101, 102, and they might only happen once or twice a day. Whereas in bacterial type, we might see those fever spikes happening 3-4 times a day until treatment is started.